Liposuction is simply removing fat in a convenient and easy manner. You can remove fat by cutting it out or by destroying it with chemicals or whatever, but liposuction is sucking the fat out. And one's sucking out not just fat, but fat cells. And if you remove fat cells, then you're giving a permanent change in shape. The common areas, starting at the top, would be the neck, sometimes the face, the arms, occasionally breasts, the abdomen, the hips, the loins, the inner thighs, the anterior thighs, and the ankles. The procedure of liposuction is that having decided which areas we're going to treat, we also decide where we're going to make little stab incisions to insert the cannula. These are very small, about 1 centimetre, and this little stab will be just away from the area of fat to be removed. The cannula is basically a tube, and it's a tube with a closed end to it, but little side holes towards the end. And then at the other end of the tube is the suction, attached to a suction machine to suck out the fat really as fast as one can. The first thing we do is to put in some fluid which will include local anaesthetic. This is short-acting and long-acting, so the patient wakes up without any pain. And that will last probably about 6 to 12 hours. Now the procedure, it depends how much one's doing, but it will take anything between perhaps 15 minutes to do the chin and the neck to several hours if we're doing several areas of the body. There shouldn't really be any pain because there's this long-acting local anaesthetic in place. And by the time that's worn off, then there's the pain of a bruise. And it's often quite a big bruise, so people feel a bit stiff with bruises. We try to hide the small incisions that are made to do the liposuction, and mostly we're successful. But if there are in areas which are visible, then there may be these little stabs. They're very small, and they're not usually a problem, but it can be that occasionally people will be aware of them. There are some risks with liposuction, and I've touched on the loss of blood. So some people feel weak for a couple of weeks afterwards if a lot of fat and consequent bruising has occurred. Actual risks, there is, I suppose, the risk of perforation of some part of the body with the cannulae, and this is exceptionally uncommon. Infection is very rare. You could almost say it doesn't occur, except where skin is being excised at the same time, where liposuction is just part of the procedure. And so this might occur in someone having an abdominal reduction. Liposuction, of course, is permanent. You've removed fat cells, so it's a permanent change in shape. Now, when people put on weight, fat cells just get bigger. When they lose weight, they get smaller. But there are fewer fat cells. So if after liposuction people maintain their weight, then that's no change. If they gain weight, then all the fat cells on the body will get bigger, but less in the area treated because there are fewer cells. So it's still a permanent relative change of shape.